Griffin has embarked on a bold initiative to provide compassionate care for individuals in emotional crisis.
The EmPATH Psychiatric Crisis Observation Unit.
We need your support to help fund this critical project for our community.
I was having panic attacks and just having a really difficult time getting by. I had panic attacks, but this one happened with my wife in the bed, and I'd sort of been hiding it, but it became a situation where it was happening in front of my family. So that's when I really started thinking I needed to get some outside help.
Sadly, too often, people are sent to emergency rooms when encountering psychosis, suicidal thoughts, substance intoxication, or developmental disabilities. This can worsen symptoms due to a lack of specialized staff and the inadequate space for crisis care.
My brother, he's been to Griffin ED, several times throughout the years. He's usually very agitated. He has psychotic symptoms of voices talking to him. He has paranoia. He becomes very aggressive and defensive.
Well, on the first visit I came in, I said, I'm having a mental health crisis. I had to change into scrubs. I was out on a bed that was in the hallway there. It was strange. The whole experience was odd. I felt like, I was sitting there on this bed in scrubs, which most people aren't, like I was wearing a scarlet letter.
In fact, psychiatric patients spend 3 times longer than other patients in the emergency department, leading to overcrowding, patient disruption, and further worsening of their mental state.
Patients will reach out and they want help, but then they're directed to someone that now tells them there's a 6-month wait, which forces people to come to the ER. And it burdens the ER systems too, because you have not only behavioral health, but you have medical patients that are seeking care. And they're all coming to one spot that has limited resources for everyone.
We have seen at least 1 in 7 patients come into the emergency room in a mental health crisis.
I think the current design, it's not suitable for patients with mental health because it's just too constricted. There's nowhere for them to really walk, and feel free there. Kind of works against their healing, their mental health.
By creating the EmPATH unit, Griffin Health will transform care in our community. This specialized approach will relieve pressure on our emergency department staff, allowing them to focus on critical medical emergencies while ensuring that those in emotional distress receive the dedicated care they need.
So people come into an emergency room in the worst day of their lives, being able to be seen by a crisis clinician, be moved to then this unit in which the healing process will start. The treatment is not only medications. The treatment also is very much related to the environment. Being able to decrease the crisis, learn coping skills, and continue the process of the next steps.
The EmPATH unit, it's designed just for those patients in a space that's going to be low stress, low stimulation, therapeutic, more staffing, social workers assigned right on that unit to engage them, to work on resources, have more time to develop resources that there's not as much opportunity in the emergency room to do.
There's a lot of research that shows that these particular units have decreased the amount of inpatient stays, violence in the hospitals, decrease the need of resources. That improves patient experiences.
The EmPATH unit is important because the hospital is already offering a lot to the community. It's got good programs, and this is going to be something that would just kind of bring things to another level.
We all know someone around us who's struggling with addiction, with mental health issues. We have to think of what kind of place do we want them to come to.
If I didn't have Griffin, I don't know where I would be. In situations where I need behavioral help, they make me feel like I'm a person and not an animal. Last year, I had lost a lot of my friends due to death. And when I came to the behavioral health department in Griffin Hospital, I got so many hugs. I feel safer at Griffin than any other hospital.
Your support is crucial in making this vision a reality. Join us in funding this critical facility and help those in emotional crisis find the care they deserve. Together, we can make a meaningful difference in the lives of our neighbors.
Having a beautiful space that can be therapeutic and helpful to our community members just exemplifies why Griffin is who they are, because we're putting the patient first. We're doing the right thing for them in the absence of other resources.
Griffin Health, empowering people, advancing care.